and welcome to the Dr. Oz Show. I'm your host, Dr. Oz, and today's segment is focused on the endocrine system. Please help me welcome our special guest, Dr. Koala.
Hi, I'm Dr. Koala, and I'm here to talk to you today about the thyroid gland. Your thyroid is located below your larynx, and it secretes the hormones thyroxine and triiodothyronine to help maintain a normal heart rate, blood pressure, and normal body temperature. The thyroid stimulates enzymes that are associated with glucose oxidation and oxygen consumption, which generates heat and increases cellular metabolic rates. It also promotes the usage of carbohydrates over fat. And now we are going to head over to my patient, Rachel, who is sadly suffering from thyroid cancer. Hello, Rachel.
Hi. Well, I've been fighting it for a while now. I've had surgery and radiation therapy to get rid of my abnormal grouping of cells.
Wow, that's a lot. Has it helped?
Yeah, it's helped a great deal, but I still need to take hormones because my thyroid isn't there anymore, so I need to take hormones to maintain homeostasis.
Wow, it must have been pretty serious to have to take out your entire, or almost your entire thyroid. And you said you're on thyroid hormones now, right?
Yeah, but I'm free of cancer, so.
That's great. I'm happy for you. I'm sure you feel a lot better. Well, how did you find out that you had cancer in the first place?
Well, it was very odd. I always felt like I was sick because I would cough a lot, and my ears and my neck would always be painful, and my neck would be swollen, but I wasn't sick, and I'd always have a hoarse voice.
Interesting. Well, look at you now. Well, thank you for your time.
Thank you.
And next we have former pop star Hannah Montana.
Hi.
And we have a secret for you.
She's really Miley!
But more importantly, she also is suffering from one of the most common endocrine diseases of the United States, diabetes. So Hannah, or Miley, you have type 1 diabetes. So what does that mean?
It means my body cannot properly process glucose due to the complete stop of production of insulin, an important protein secreted by the pancreas.
Sugar enters the bloodstream, but one of two things happens. Either the pancreas does not produce a sufficient quantity of insulin to match the sugar entering the bloodstream, or the body cells do not respond to the insulin that the body is producing. In both cases, the result is the same. Cell doors remain closed, causing sugar to get backed up in the bloodstream. As a result, blood sugar levels rise. This creates several problems. Because sugars are not able to enter your body's cells, your body is not getting the fuel it needs. As a result, you may feel tired or fatigued. Your body may try to dilute the excess sugar in the bloodstream by pulling fluid out of your cells. This can leave you feeling dehydrated and thirsty.
So Miley, how do you cope with diabetes?
I test my blood every day by pricking my finger, and I take daily insulin injections.
So before you were diagnosed, how did you know that something was wrong?
I was very thirsty all the time. I needed to go to the bathroom all the time. I suffered from extreme weight loss, increased in hunger, blurry vision, and I was very irritated a lot.
Thank you for joining us today, Miley. And we will be right back after this commercial break.
The thyroid is a butterfly-shaped gland that sits on top of the trachea or windpipe. It's made up of the right thyroid lobe as well as the left thyroid lobe, and they're connected by the isthmus or the centerpiece. Occasionally there's a finger of tissue called the pyramidal lobe that extends towards the head. The thyroid creates thyroid hormone, which helps regulate your metabolism. There are a lot of important structures in the area, including the parathyroid glands. These are 4 small glands that sit behind the thyroid and control the calcium levels in the blood.
And next I bring to the floor Ohana, who has Cushing's disease, which is the overproduction of a pituitary gland hormone that leads to an overactive adrenal gland. Now, can you tell me what the adrenal and the pituitary glands are?
Sure. The adrenal gland is 2 glands that sit on top of my kidneys that release the hormone cortisol. My pituitary gland, however, is a gland found on the base of my brain behind the sinuses. It is often called the master gland because it influences many other glands, especially the thyroid.
So how is Cushing's disease affecting your life?
My pituitary tumors create an excess ACTH, which is a hormone that stimulates the production of cortisol of the adrenal glands.
What are the different ways that you could treat Cushing's disease?
I could get surgery, but I don't really like that idea. So I'm deciding to get radiation therapy, or I could take medicine to control my cortisol production.
And we'll be right back to the show after this sneak peek of our mystery guest.
Parathyroid glands monitor and control the amount of calcium in our blood and bones by secreting a hormone called parathyroid hormone, or PTH. Each gland monitors the blood calcium and responds by making more or less PTH hormone. Hyperparathyroidism is a disease that occurs when one of the parathyroid glands develops a tumor. This tumor produces far too much parathyroid hormone, which is released into the bloodstream. The excess parathyroid hormone travels through the blood and into the bones. The hormone activates cells within the bones to eat away at the bones, often causing osteoporosis, fractures, and bone pain.
Hi, and welcome back. I'm Dr. Koala, and we will be interviewing today A from the hit TV show Pretty Little Liars as our mystery guest. A has so many identities that now she's a brunette. So A, can you please tell me what hyperparathyroidism is?
Hypoparathyroidism is an excess of parathyroid hormone in the bloodstream due to overactivity of one or more of the body's 4 parathyroid glands.
The parathyroid glands produce parathyroid hormone, which helps maintain an appropriate balance of calcium in the bloodstream and in tissues that depend on calcium for proper functioning, such as the bones. So A, what are some of your options to treat your hyperparathyroidism?
I could take an anti-thyroid medication that interferes with the production of thyroid hormones. I could also take beta blockers to block the effects of thyroid hormones on my body. For example, beta blockers help slow down a rapid heart rate and reduce hand tremors.
And we'll be right back after this commercial break. Stay tuned to see what really happens in your body.
And here are some facts about the endocrine system. Corticosterone is a similar hormone to our cortisol in birds, rodents, and reptiles. The endocrine system can be at fault for osteoporosis or the breakdown of bones, which can be caused by PTH. Hormone is a term used only about 100 years ago. The pancreas works as an endocrine and digestive gland. Alcohol can decrease the production of testosterone and damage testes. And plants produce hormones without an endocrine system.
Some common misconceptions about the endocrine system are that hormones are only prevalent during puberty. This is absolutely false. Hormones are prevalent from the day you are born until the day you die. Another misconception is that the endocrine and nervous systems are entirely different and unrelated systems. This is false too, because the hypothalamus is actually the bridge between these two systems. The hypothalamus gets nerve impulses and sends out endocrine hormones based on the nerve impulses. Also, cholesterol is bad. This is false too, because some cholesterol is good because it is the base of some hormones such as estrogen and testosterone. But if you have too much cholesterol, it could clog your arteries and lead you to having a higher risk for having a heart attack. Also, testosterone is only in men. This is surprisingly false. In females, testosterone is converted into oestradiol, a type of oestrogen. And we're back to the show. Next on Dr. Oz, we'll be taking a look inside baby Rufus. Good morning, class. Today we will be learning about your future jobs.
Finally!
Thyroid, you are in charge of sending everything to the pituitary gland and how fast Rufus's body operates.
That's really cool, but what if Rufus doesn't give me what I need?
Oh, we know this one! You die!
Not quite. However, you will have to work harder and cause Rufus to have a swollen neck. This shouldn't happen though, because all you really need for food is iodine. You can get iodine from table salt, seafood, or milk.
What do I do once I get the iodine?
Good question. You are in charge of Rufus's metabolism as well as his digestive system heart rate, muscle control, and brain and bone development.
So how do I know how hard to work?
That's easy. I control how fast you work.
Or how many hormones you produce by sending TSH. Yes, that's exactly right. Oh, this class went faster than I thought. Well, have fun in your other classes, girls. I'll see you tomorrow.
Welcome, students. How was your last class?
Good, but I'm glad to be in a class that actually focuses on us.
I understand. When I was a young gland, I would skip classes about other glands. That's a story for a different day. Today we will talk about your future functions. Anterior, can you tell me what your main role is?
Is that what the hormones?
Yes, good job. You have to make a lot of different hormones, most of which stimulate hormones.
Wanna trade?
There will be no trading. As I was saying, you produce ACTH. ACTH stimulates the adrenal glands to secrete steroid hormones. Growth hormones fuel child growth, and the production slows at middle age. Gonadotrophins are responsible for the maturation of sex organs and the production of egg and sperm, respectively. Prolactin stimulates milk production. Thyroid-stimulating hormone stimulates the production of thyroxine and triiodothyronine. Welcome to class. Today we will be learning about the pancreas.
Oh, that's me!
Good. Do you know what hormone you need to produce?
I also have to produce glucagon, which raises Rufus's blood sugar level.
Good job. What is the most important hormone you will produce?
Of course, it's insulin. Insulin helps lower Rufus's blood sugar level.
That's correct.
But what's so special about me?
Well, pancreas, you are a very interesting organ because you function for the endocrine and digestive systems. The special endocrine cells are called the islets of Langerhans. The pancreas releases insulin and glucagon. Insulin lowers blood sugar levels, whereas glucagon raises them, but you can malfunction. If you do not produce any insulin, the human you work for will have type 1 diabetes, like Hannah. If the body improperly uses the insulin you make or you do not produce enough insulin, the human will have type 2 diabetes.
So what about me, the hypothalamus? What do I do?
Well, you send your releasing hormones to the pituitary gland first, and from there they go to the other glands and organs. Growth hormone releasing hormone causes the release of growth hormone in the pituitary gland. This hormone fuels child growth. Thyroid stimulating hormone, TSH, causes the release of thyroid hormones. Gonadotrophin releasing hormone causes the release of gonadotrophin in the pituitary gland, which helps the development of reproductive organs. Thyrotrophic releasing hormone regulates the secretion and production of TSH. Oxytocin causes the contraction of the uterus during childbirth and lactation.
And that's all for the show. Thank you for watching the endocrine version of Dr. Oz.
The pineal gland is a small gland in the brain that releases melatonin and regulates the body clock. Melatonin regulates sleep patterns and is the cause of jet lag. Other than this, scientists do not have much other information on it.
Your thymus, the large orange structure, is located in between the lungs, the dotted structures. The thymus is only active until puberty. When it is active, it plays a big role in preventing autoimmunity. It secretes thymosin, which stimulates the development of T cells for the lymphatic system. The ovaries secrete progesterone and estrogen. There are actually three major estrogens, known as estradiol, estrone, and estriol. These hormones work to promote the healthy development of female sex characteristics during puberty and to ensure fertility. Estrogen, specifically estradiol, is key in breast development, fat distribution, and the development of reproductive organs. The testes produce testosterone, which is important during the first stages of development of the male sex organs. Also, it causes the sex characteristics of males, such as a deepened voice and facial hair. It helps maintain these characteristics throughout a male's life. Testosterone production and secretion is monitored by luteinizing hormone, or LH, and follicle-stimulating hormone, FSH, from the hypothalamus and pituitary glands. The part shaded in blue is the adrenal cortex. This releases cortisol, also known as the stress hormone, which regulates changes in the body in response to stress. This part of the adrenal gland also helps maintain glucose levels in the blood and helps with immune responses. The part in purple is the adrenal medulla, which secretes epinephrine, more commonly known as adrenaline. Epinephrine is released into the bloodstream to cause an increase of heart rate and muscle strength when one is stressed. It is also responsible for the fight or flight response. Also secreted by the medulla is norepinephrine, which is a neurotransmitter and a hormone. As a hormone, it increases heart rate and blood pressure. As a neurotransmitter, it relays brain impulses from one cell to the next and is involved with attention and mood.
Follicle-stimulating hormone, or FSH, stimulates sperm production in the male testes, as well as estrogen hormone secretion and egg development in the female ovaries. Prolactin, or PRL, stimulates the formation of mammary glands in the female and production of milk. Luteinizing hormone, or LH, induces ovulation in females and stimulates estrogen and progesterone hormone secretion in preparation for pregnancy. In males, it stimulates the production of testosterone hormone in the testes. And oxytocin helps prepare the uterus during the last stage of pregnancy for labor and delivery. After delivery, oxytocin is also involved in producing milk in the mammary glands.